Hi everybody. It is Friday, September 25th, 6th. I don't even know. Oh well. Anyway, my grandson Dominic turned 17 yesterday. I worry about him so much. Some girl is gonna rip his heart out. He is the most tender soul. I've never known anybody like him. He's saintly. He literally is saintly. He will give away everything he owns if you need it more than he does. He's extremely compassionate. He's extremely empathetic. His empathy game is strong. And he loves everybody. He just does. And he's humble about it. He doesn't do it for attention. He does it because he genuinely, sincerely wants to do that for you. He's an amazing kid. Anyway, I digress. So it looks like I'm going in for a bone marrow transplant. Stem cell transplant. In possibly another month. Maybe a little less, maybe a little more, but around another month from now. I can't even tell you the things that I have been through that have left my body so weak and so tired, and I'm dizzy all the time. Last Tuesday I went in and had a needle in each eye for my retinas. And then the following Tuesday I had blood work, a biopsy, and then a transfusion. We were there from 10:40 in the morning until 7:20 at night on Tuesday. But we talked to my oncologist about this stem cell transplant. She came up with this clinical trial that she wants to try. Basically, it's part of the conditioning that they do before they introduce the new cells. So it's part of the whole chemo and kill everything off thing. But they want to try something where they try a combination of A plus B first, and then try B plus A second, to see if the difference is in the order in which they are applied. There's more to it than that. That's simplified. The FDA would not give Roswell the go-ahead unless they had someone who's actually having a stem cell transplant volunteer for that clinical study. And so I did. I signed the consent form. It's really not going to change anything except the order in which they give me the drugs for just 2 of the treatments. So I'm going to be getting conditioning for anywhere from 7 days to 11 days. And conditioning is just killing all my stem cells with chemo every day for those 7 to 11 or how many days it takes. Then after that, they reintroduce the stem cells from a donor. Now, they do this completely differently than they used to do even just 50 years ago, or even just 20 years ago. It's a kinder, gentler transplant. And they've also found that with this kinder, gentler transplant, they have amazing success. And my oncologist herself, I think she says that she has a 74% rate of success. But she's really excited about me. She's like all fired up about this. I don't know if it's because I agreed to her clinical study, So she gets her golden ticket from the FDA, which will help her immensely and in turn hopefully help other patients in the future. That's why I did it. I don't want anybody to go through what I've been going through if they don't have to. I suspect insurance has a great deal to do with why we waited until now to finally do the transplant, because I've been asking for it for a few years. I think they have to prove to the insurance company that they tried everything else first. And they have. None of it worked. It worked for a while and then it would stop working. So I would go to the next treatment. It would work for a while and then stop working. Then the next treatment and it would work for a while, stop working. And then this last treatment had the potential to put me in remission, but it did not. And with that one, they know within 6 months before they can determine whether it's, a good thing or a bad thing. But I will change physically, possibly. All my hair will fall out. I don't care. It's just hair. I've donated it several times anyway. It always grows back. But I might grow back an afro instead of this. Isn't that crazy? And I may have certain taste for certain foods that I never had before. And I may not like the stuff I've always liked. So it's going to be interesting. I don't know whether or not I get to meet my donor. I know people have, but at Roswell they seem to keep it pretty well top secret. I don't know if I like that, because I want to thank the person who saved my life. I just want to do something. I mean, they saved my life. Granted, I'm still waiting to hear definite. We have appointments scheduled until January 9th. I'm supposed to try to squeeze in a cataract surgery between now and the transplant, but I call the doctors, my retina specialist, for the referral. They don't answer the phone and they never return my call. So I told John we need to just drive right up there. And I will say it loud enough for everyone to hear. Well, I've been calling you since last Friday. Nobody answers. And when I leave a message, nobody returns the call. So we had to come here to tell you that Dr. Ram was supposed to give me the name of an eye surgeon, an eye doctor. And we left without it. We didn't get it. So I've been calling all week to try to get that information so I can get the cataracts taken care of. I live in the dark. My vision is going, and it's going fast. And it's scary. But if I get the stem cell transplant first, I can't have any medical procedures for a while. So it would have to wait and get worse. So wish me luck with that. I'm going to try again today. I just wish they'd answer me. And it doesn't matter if I push operator. I still don't get anybody. I get nobody to talk to. So, also, with this news, please be patient with me while I am emotional, because this is a big deal. I am equally excited and a little scared, because anything can go wrong. And it wouldn't take much to just fuck up everything. So, anyway, please pull for me for the next few weeks. I'll keep you posted as developments happen. We've had the biopsy. We've had the blood draws. And here we go from here. I just got to get my cataracts done, and I don't know if I have time because my oncologist said this transplant could take place in the next 3 or 4 weeks. So just send a thought to my way. I'm an atheist. I don't pray. But I believe in my universe. I believe in myself. And we'll get through this. But I could use support. Thanks.